A 32-year-old female patient presented with weight loss associated with palpitation and heat intolerance. Her mother has rheumatoid arthritis and sister is on thyroxine replacement. Clinically, she has large neck swelling. So, what is most likely diagnosis? A 32-year-old female patient with weight loss and palpitation and heat intolerance and a uh, large neck swelling. Neck swelling, what structures are present in the neck? In neck there is trachea and thyroid gland in front of the neck. So neck swelling, we can suspect that there may be pathology in thyroid disease. And palpitation, heat intolerance and weight loss results in hyperthyroidism, because in hyperthyroidism patient has palpitation, patient has weight loss, and patient may complain of a heat intolerance in hyperthyroidism. So what is most likely diagnosis? Most likely diagnosis in female patient with the hyperthyroidism is Graves disease. There may be Graves disease or hyperthyroidism. Yes, diagnosis is Graves disease. And the another question is, what will you investigate in Graves disease? So we will perform the investigation of TFTs and a radio thyroid function test, radioactive iodine uptake, and TREBS. We perform these three labs in order to diagnose whether patient has hyperthyroidism or not. And another laboratory investigations, we will perform T3, T4, and TSH level. We will look at these level. These will be altered in hyperthyroidism. And what are the treatment options? Treatment options are propylthiouracil. We can give treatment of propylthiouracil or carbimazole, or we can perform surgery, or we can give beta blockers in order to prevent palpitation and tachycardia, or we can perform surgery to remove thyroid, enlarge thyroid gland. So this vignette has clearly shown that a patient had weight loss, palpitation, and heat intolerance occurs in hyperthyroidism, and enlarged swelling of the thyroid, or the enlarged swelling of the in the neck. So we suspected that patient may have hyperthyroidism, because in hyperthyroidism patient complaints of palpitation, heat intolerance, weight loss, increase appetite. Patient will lose weight despite increase in appetite. So the patient T3 and T4 is decreased in this patient, and TSH level is increased in Graves disease. That's why patient present with certain these complications.